You can't do high-end dentistry with low self-esteem. Monday morning, look in the mirror and say, I'm great. I'm an FMR doctor. I'm starting this path on education. We started FMR in 2008, so it's been about 17 years right now. We started with basic general dentists. Now it's evolved into implantology and learning implants. What we teach is functional opportunities for their patients, aesthetics, and then implants and how to incorporate it together. Another big factor about FMR is that we have a business component. The doctors need to know how to run their business efficiently, predictably, without mistakes, without problems, and getting their team together to make that efficient dental practice really work for them. We're reaching about 200 to 300 dentists a year, face-to-face, and over 1,000 dentists online. We customize our education to your practice. So if you have a small practice and you're a solo provider, it's very different than when you have a group practice with 5, 6 providers. So we really tailor to that. We had some great doctors coming from all over, Canada, down south, Mexico, Chicago, LA. We got really doctors from all over, and it was great to see the different experiences that they've had in their lives and their careers.
The other thing that I'm really taking away from this is that, to your point, I think I just needed to know, and you didn't say this directly to me, but I feel like I can do it. So that feels really nice to know that I may be able to take the next steps.
Yeah, 100%. You can do it.
Just the idea of feeling like you have support in that way, it's really nice.
I was anxious that if I'm gonna come to FMR, there's really not much to learn, but actually I learned a lot.
And we want to give them that confidence to really take the patients that they have and get them to a better dental state.
I feel like in dental school, there's, they put limitations to things and they tell you this can't be done or that can't be done or this could cause pain for the patient if you open them up a certain way. And this really opened my mind to what the possibilities are and that it's all doable. You put the systems into place and it can all be done.
Wherever my career goes as a GP, FMR is something that's so important for us to know how to do. Whether it is the full crux of your office or if it's something that you only do sometimes, I think it's just something you should know how to do as a general dentist.
The first and foremost thing about FMR is the faculty and the mentorship. That's number one.
You want a community where people actually allow you to be who you are, actually want you to have fun, and keep you accountable. It's very hard to find that combination of people that you could actually call and help you.
We continue with our doctors over the course of their career. When we do our education, we get really close one-on-one personal. We don't have 100, 200 dentists coming in. We don't want that. We want a personal relationship. We create a very good experience in New York City, and they're part of a family together that they can reach out at any moment in time.
It's such a pleasure to be able to have faculty that are so approachable, like Dr. Katz, Dr. Bean, Dr. Smallworth, Dr. Joanna. I've never had that type of relationship immediately. I was so comfortable. So thank you for that.
The biggest thing about dental education is it's a one-time lecture and then you kind of never see the doctor again. We're very approachable. All the faculty has their numbers. We give them the access to our offices. They can come into our offices and actually watch us work live demonstration. So these are things that no other course in the world does. And in terms of occlusion, we're really the only one that does live patient education on occlusion.
None of this has been anything repeated from my residency program where a lot of the attendings were doing FMR, and none of it was anything I had learned from any of the CEs that I've been taking either.
I really recommend this course for any dentist who is entry-level or experienced dentist who wants to know more and offer their patients the best of the best. Thank you, Dr. Dean. Thank you, FMR team. I loved it. Amazing, amazing. Just keep it up. Such a blessing to have you people around and helping us changing lives. You're changing my life, and I cannot wait to do that and change more lives. Thank you so much. See you soon.